ALTA-1L is a frontline study looking at the use of Brigatinib compared to older ALK TKIs. And when we compare Brigatinib to Crizotinib, we're finding that overall it's a better tolerated drug, but it is significantly more effective. We see a clear benefit. And we have, based on the ALEC study, a standard of using alectinib, based on a comparison of alectinib to Crizotinib. In ALTA, we're comparing Brigatinib to Crizotinib, and both are strikingly similar, actually. We see very similar, durable, meaningful PFS rates. And our expectation is that this is a drug that hopefully will be available to our patients soon. Now, it draws the immediate question of which should I use? Should I use Brigatinib or alectinib? Clearly, no longer Crizotinib. That's no longer our standard of care. But alectinib was better than Crizotinib. Brigatinib, clearly better than Crizotinib. We don't have a head-to-head comparison between those two in the frontline setting, and we probably won't. I don't know that we need to. I think they're both very well tolerated, both highly active drugs, and slight differences in dosing, in schedule, but overall the drugs are somewhat similar. Now, if we look in the pre-treated setting, patients post-Crizotinib, the duration of benefit for Brigatinib was quite a bit higher than alectinib. It doesn't seem to have translated to a better PFS in the frontline setting because across trial they seem very similar. In vitro, Brigatinib does seem to have more activity against some of the resistance mutations that are seen within ALK. Could that change the patterns of resistance after frontline therapy? Maybe, and we don't really know how that will affect subsequent therapy. Right now, I think that once approved, they'll both be viable options. I think a lot of it will come down to preference. And what will be interesting in years to come, how is acquired resistance to alectinib in the frontline setting different from acquired resistance to Brigatinib in the frontline setting? How does that influence efficacy and therapeutic options subsequently? And that can help inform ideal sequencing. But right now, once approved, I think both are very reasonable options, and they're both excellent drugs.